So, hi everyone. My name is Phedias Diamandis. I'm a neuropathologist at the University Health Network and a scientist at the Princess Margaret. And I'm very excited to be presenting some work funded by the American Brain Tumor Association today, which is entitled At-Home Monitoring of Brain Tumors Using Consumer-Grade Wearables. So, um, you probably know that brain tumors are a very challenging disease to treat because they're very difficult to detect, and even treatments at these later stages are not as effective as we hope. So one of the potential solutions is to try to find ways to identify these tumors earlier in their evolution and progression, which may make even conventional therapies that we have available today more effective for immediate use. Now, unfortunately, unlike other tumors where we do have very effective early detection programs like breast cancer and colon cancer, brain tumors are difficult to detect early using these early detection paradigms. And there's a number of reasons why that is. Firstly, to study the brain, we need very expensive imaging technologies like an MRI scan, which are usually only available at tertiary healthcare centers. And usually, most early detection programs work very effectively for cancers that are fairly common. And unfortunately, brain tumors, while aggressive, are fairly rare. Only about 4 out of every 100,000 people will develop these aggressive brain tumors called gliomas every year. And the symptoms that may alert someone to go get scanned, like a seizure or a persistent headache, usually occur once the disease is established, making early detection difficult. Now, you may ask, why don't we just scan everyone um, uh, annually? And that here lies the problem of these current technologies. You would need to scan hundreds of thousands of people to just detect a handful of cancers. And the rapid evolution of these tumors suggests that even if you were to get an annual MRI scan, these tumors may develop during that year because of their aggressive nature, and you may even miss them, even with this very expensive strategy. So what we need is alternative ways to monitor brain tumors that are cost effective and can be applied to the general population. So the solution that we're exploring is the use of brain wearables that, as this picture shows, are bandana-like devices that you can wear around your ears, sort of like glasses. And they have these metallic probes that can capture electrical activity that your brain is transmitting while it's carrying out day-to-day functions, and reaches outside of the skull. So just by wearing these devices, we can detect how the brain is functioning. And these devices, which you can buy on Amazon, are used to monitor your brain activity during meditation and concentration exercises to help you improve your mental states. So we're exploring just the way that you can use an Apple Watch to detect abnormalities in your heart rhythm. We're exploring if you can use these brain wearables to detect potential defects in your brain activity that may signal that there may be a tumor or another type of lesion that may be interfering with your brain's normal electrical communication. And because these devices are being rapidly um, deployed in various things that we wear on our head, like bandanas and glasses and headphones. Hopefully, if we can detect brain tumors with these devices in the asymptomatic stage, perhaps at a population level, we can start alerting people to seek medical attention while these tumors or other diseases may be in a more treatable state. So to do this, we developed a software that can conveniently connect to these consumer-grade devices and allows patients to record data through a standardized set of meditation tasks. And then that data can be analyzed in a very standardized way to see if there's any abnormal electrical signals that may be occurring that would be concerning for brain tumors. So using the software that we've developed over the past few years, we've been able to deploy it in some brain tumor patients. These are 4 of our 5 initial patients. And what you can see is that in this particular brainwave called a gamma wave, we see that there is asymmetry uh, towards um, the left side or the right side, as shown by the direction of these bars. And these asymmetries are consistent over multiple sessions. Some patients have recorded over 45 weekly sessions. So there's asymmetries that we can detect, and they usually localize to the side of these patients' tumors. And what we're doing here is that we're monitoring for potential recurrences in these brain tumor patients while they're at home, and they don't need to come to the hospital for their regular scans. Of course, they do, but we're seeing if we can help give them more kind of week-to-week resolution of any differences that may be evolving in their brains. Interestingly, in this patient, this is actually a patient with a vascular malformation. We see a different signature where the gamma wave is has a preference for the side without the lesion. So potentially, not only can we detect differences, but there may be differences that are different than other patients that have non-neoplastic diseases. Excitingly, that these gamma density differences were not detected in healthy controls, suggesting that these may in fact be very cost-effective ways to detect and study the evolution of tumors right from the patient's home in between these hospital visits. So what we're doing now is we're using machine learning and artificial intelligence to take these weekly data points and try to predict when things are changing on a week-to-week basis, and kind of provide an alert to patients to that their tumor may be evolving in between these hospital visits. If this is successful and these EEG devices get incorporated into more of our daily equipment, like headphones, we will hopefully be able to survey a population and try to identify these brain tumors earlier in their evolution, so we can potentially alert patients to get earlier treatments and hope for better outcomes. So thanks for listening. I want to thank again the American Brain Tumor Association for funding this project. We've been able to recruit and retain very talented students, Rick, Ingrid, Alberto, who is a research associate, to kind of develop this project, and we're excited about the potential future implications for early detection of brain tumors. So thank you very much, and thanks for listening.